you guys, obviously, I'm going to leave that to you guys to introduce yourselves, but I'm going to introduce Joe. Joe, you guys know Joe already. Joe is one of our strong volunteers for the youth development program. He's leading our phase 2 program. That's basically anything to do with work experience, anything to do with mentoring, apprenticeships, and personal development. So basically that's what Joe leads. So some of you guys here will be working with you guys already, or some of you guys will be working with you guys just the engagement activities. What we want you guys to start thinking about is just not the engagement activities. We are a charity. You need to think about employment and career and what do you want to do in the future. While you enjoy yourself with us playing volleyball, basketball, football, we want you to start thinking about what you want to do in the future, because that is really, really important. And we're here, we have a perfect platform to facilitate that for you. You need to think about it, come and talk to us. What I like is young people in the community coming to me and say, I want to go for a work experience. That's a problem I like, because then we have to find you something. All you need to do is just come forward and say you want it. We've had a lot of young people going for marketing, sales, HR, and all this is great. And some of you guys are going to be awarded on the 14th of July for the great work that you have done throughout the year. So come forward, talk to us, and let's see what we can do to help you secure that better life you deserve. So today we've got Kelly and Javier who's going to talk to us about NIHR, their jobs, what they do, and what opportunities that you guys can actually get at the back of that if you're interested in that.
So if we kick off in introductions, so I'll start off.
Hi everyone, I'm Joe. I'm a volunteer for Urban. I work as a strategic planning manager.
Hi, I'm Javier. I'm a college student in Harvard College. Yes.
I'm Kira. I'm also a college student at the same college. So yeah.
I'm also a college student. I'm Kingsley. I'm not a college student. Unfortunately, my college years are way behind me. I am really an urban volunteer. I think we're doing a great job, and I want my son who's over there, he will introduce himself later, to get involved this early so that hopefully there's opportunities for him later on in his life. Thank you.
Hi everyone, my name is Joy. I play for the Avon volleyball team and I just left secondary school.
Hello, I'm Ingrid and I also just left secondary school and I also play for the volleyball team.
Hi, I'm Adebayo. I also just left school and I play for the Avon volleyball team.
I'm Barama. I'm a sixth form student at Oaklands.
I'm Malachi and I don't actually live here, I live in Southampton and I go to Regent's Park School.
That's just up the road from me. I'm Kelly. I live not that far away from Regent's Park School in Southampton, and I work for the NIHR Clinical Research Network.
And I'm Javier, and I'm one of the research nurses also in the CRN, so working with Kelly.
Superb. So now that we've got introductions out of the way, we've invited our lovely colleagues here to give us an overview of what their jobs are and talk about how they got into them, how their careers progressed so far. Hopefully that triggers a conversation with you guys if you've got any questions or if any of you are interested in a potential career within research. Okay.
Oh, thanks.
Yeah, so as I say, I'm Javi. I'm a research nurse at the moment, but I train as a nurse. So just a bit of background of how I got into it. So I'm from Spain. I was lucky to go to university there. I did nursing. Did I always know I wanted to do nursing? No. I think, just through my college years, I knew I didn't want a job that it was based in an office all the time. I wanted something a bit more dynamic. And I thought it just felt right to what I wanted at that time. So after training back home in Spain, I moved here and I specialized on a specific area. Mine has been intensive care, so I've always worked in intensive care around the country. And something that was really interesting for me, as you can imagine, as a nurse, as a doctor, anyone that was in the hospital, what you want to do is help people getting better. So throughout my years working in the hospital, you know, at the beginning when I started, we were giving some medication or doing some things, and then a few years later, we changed that, or we were giving different medication, doing different things, and at some point I stopped and think, you know, what is making us change all this? What, you know, because we're definitely doing better, we're helping more people that are sicker getting better. So what is the change? What, you know, where all this comes from? And it started being related to research. So all these studies that they saw, oh, this medication is better than this other one, or, you know, it's better if we do this rather than do that. And that is why it's really helping us, you know, helping people to get better, getting out of hospital, getting back to what, you know, their families. So I think that's where my passion for research started to grow. So I was just looking for a change, and there were some jobs in the NIHR. So the NIHR is the National Institute for Health and Care Research. It's like the research arm of the NHS, basically. So I just moved into there. That's where I'm working at the moment with Kelly. And my role now is as a research nurse. So what I do is I help all these studies that are coming. I help delivering them. So if there's a study for a new medication, I am one of the nurses that will speak with all the people that are coming forward to take part in the study and make sure that it's safe for them, make sure that we are giving them all this new medication, making sure that they're okay with it, speaking with them, following them up, and getting all that information that then in the future is going to help deciding, is this better than this other thing that we're doing before? Is this driving and helping more people forward? So that's what I do at the moment, and yeah, really passionate about research because I've really seen firsthand from when I work in the hospital the difference that it can make. So I think that's a very short summary of me. I'll hand over to Kelly now.
Thanks, Javi. I'm much older than Javi, I'm very old. So I've been working in research for over 20 years now. And when I left school, when I was your kind of age, I had absolutely no idea what I wanted to do. And I remember spending lots of time with the careers advisor at school and college and came out really still none the wiser about what I wanted to do. But I was always one of those kids that was asking the question why, but why, which I think was quite frustrating to my parents, but has stood me in good stead for a career in research, because that's exactly what we do in research. We're always asking why and trying to find out more and learn more, as Javi has talked about. So I fell into a career in research, as many people do. If you talk to people that we work with, we have very similar stories. Generally speaking, when people are growing up, you don't hear someone say, I want to work in health research. That's just not what you hear people say. You hear people want to be doctors, train drivers, you know, all sorts of things. But working in health research generally isn't something that people consider. But we're really passionate about what we do. So I fell into it over 20 years ago and have absolutely no desire to do anything else other than work in research. I've had lots of different jobs in research over that time. So I started out in a clinical trials pharmacy, working on developing all of the new medicines to treat illnesses and to make people better. And that's where I really got into all of the regulations around research, because what we want to do is make sure we're finding out what makes people better and finding out which treatments are less effective. And there's lots of laws around how you do that to make sure that we're keeping people safe. And that really appealed to me. I'm a bit of I like a rule. I like to follow a rule. So that really appealed to me. So from pharmacy, I was really lucky to get a job on a children's cancer ward. And I spent a couple of years working with the kids and the families who were all on different treatments to help cure their cancer, and seeing the difference that the work we were doing, seeing the difference that it made to those families when the children were getting better and had a much better quality of life through their treatment. That was really inspiring, and I thought, yeah, this is a job where I can see that I'm making a difference. And so because I love the rules and the regulations so much, I moved into a job in research governance. So basically research governance is just a fancy title for making sure that we set all of the research up and deliver that research in line with all of the laws. And I learned so much more in that job. So I'd come through working in pharmacy, learning about all of the medications, and then I'd moved on to real face-to-face roles with children and their families, but wanted to learn more about all of the nuts and bolts of how research works. And my job in research governance really enabled me to do that. And those experiences have set me up for the job that I'm in today with Javi and in the NIHR. So at the moment, I'm Deputy Chief Operating Officer for the NIHR Clinical Research Network in Wessex. And my job is amazing, I think, because I get to support Javi and the team to continue delivering all that research. I don't get to do the delivery anymore, but I did during COVID. It was all hands on deck during COVID, so it was really nice to get out of the office and back to face-to-face delivery. So I went back and did some work delivering the COVID vaccine research with the teams. I went back to my governance roots and I did all the quality assurance and the quality checking of the data. So one of the things that we were talking about this morning, Javi, was we really wanted to talk to you about the real range of different roles that there are in research. So research nursing is a huge role, but if nursing isn't the career for you, there's still a whole host of different roles that you can look at in research. So I don't have a clinical qualification. I'm not a nurse, I'm not a physio or anything like that. I don't have any clinical qualifications, but I've carved out a real role for me in a career in research. If you're one of those people that really likes data and spreadsheets, we have data managers in research that take all the data that Javi and colleagues generate and send back to them, and they analyse that data and look for trends and patterns and find out what works and what doesn't. People like me that like the rules and the regulations and work in governance, and just a whole host of other roles. So we've got lots of other clinical roles such as clinical research practitioners and clinical trial assistants. So if you did want a hands-on role with patients and you could learn to do things like take blood and do clinical observations and do all sorts of clinical skills that you don't have to be a nurse to do. So there really is such a wide range of different roles that you can get involved in. And that's why we're really excited to be working with Airbond with the work experience scheme that we're setting up. So I don't know whether it would be worth saying a bit more.
Yeah, definitely. So as Kate has just alluded to, we're currently in the process of arranging some work experience opportunities. So off the back of this, if any of you have been intrigued in terms of what Kelly and Javier have talked about, we will be setting up a process to select, I think, 2 people currently for you two guys to go into. It's the Southampton facility, isn't it?
Yeah,
for now.
Yes.
So that you can have some hands-on experience, not directly with patients,
No.
But just to see how the wider organisation works and just to get a bit more insight. So if any of you have toyed with potentially like a career in health, I think Z, you mentioned something about radiography, that sort of thing. So the way to think about work experience, which is something that I learned a bit too late probably within my career, is it doesn't have to always be related to the particular career or role that you want to do, because there's something that's called transferable skills. So just like Kelly said, if you like working with data, spreadsheets, that sort of stuff, you might go into accounting, or at the same time you might go into a career as a data manager. So it's all about thinking about what are those skills. Malachi, for example, so you're good with your hand-eye coordination because of your football. There are other sports that use that, and within a team sport, you might exhibit characteristics of a leader. That is something that you can bring into the workplace. So the way to think about work experiences doesn't have to fit the mold, as in that's the job I want to do, that's the work experience I want. You have to look at the opportunities that are available to you and think of what skills can I learn from it. So after this, Drama will circulate, I think it's probably a form that you guys will have to fill out. Then we'll go through a process, we'll chat through. Ideally, what I'd like to happen is we coach you guys to come up with your own little CVs. So you get ready for what you're actually going to have to do like in the real world. So we talk about the stuff that you're doing, stuff that you're doing outside of school. You guys play volleyball. Within that, some of you help out with the organization. Some of you are captains. Some of you have to work together as a sub team, whether it's on attack or defense. Those sort of things seem innocuous to you, like you're just having fun, you're just playing sport. But it's actually developing life skills that are relevant to your career as you go forward. So we'll talk to you about that. You'll find that I'll ask you a lot of random questions. Then out of those random questions, I'm probably going to tell you something that you didn't realize that you do, or that you think, or that you feel like. And that's normal, because I'm sure you guys had to go through psychometric tests and all that for your careers, or I suppose you're in management, so you definitely had to do that. So they ask you a raft of questions, and based on the questions, they can tell like what sort of things you're more likely to do if you're under pressure, or how good of a team player are you, or how do you react in certain situations. So the whole reason for those, it's not for you to pass or fail. It's not those sort of tests. It just understands you a bit better. Then within a team, so if you guys are playing volleyball, I'll keep going back to that. You know that sometimes when you're in a team, there's that stronger character. Then there's the one that brings everyone together. Then there's the one that is the joker that lightens up the mood. You need that in a team for you to be high functioning. And it's quite essential. And if you ask Kelly or Javi about what their teams are like, they can tell you like, right, so that one is the glue, that one is the joker, that one is the serious one, that one is the stickler for discipline. That one you can always rely on to follow the rules. So you have to think that everything that you're doing now is preparing you for the future. And you might not be able to point to like, right, I've got work experience in that, or that. But if you look within your life and everything that you've been doing, you can actually see that, look, I've developed all these skills. I'm more prepared than I thought, because you've reframed what you've been doing all that time. Yeah? So I think probably a natural progression of this is probably go around the table and see if anyone's got any burning questions. Oh, superb.
Sorry.
I know, I love that. That's amazing.
Well, my career path, right, well, the plan is to do a chemistry degree in order to do forensic science. Okay. Because I quite like, I quite like investigating things, but I was just wondering why you don't usually hear about the careers that you mentioned about, like, oh, you don't have to be a nurse in order to take some blood and look at it. I was just wondering if you just ever thought about why people don't usually hear about those types of careers, because I know that there's someone, a family friend that goes to different companies and helps the companies like come back together, if that makes sense. Like, like they're problem solver, but you don't hear about those. You only hear about lawyer, doctor, police officer. So like, yeah.
That's a really good question. I wish I knew the answer, to be honest. So if anybody thinks that they might know why, I'd be really keen to hear it. It's something we spend quite a lot of time thinking about in the network, because we always have lots of job opportunities, and sometimes we really struggle to attract people towards those opportunities, and because we all really love what we do, we are really confused as to why that is, and I think we probably need to do a bit more of a PR job about research, because it happens, or it's happened for years now. It's research is not a new concept. You can trace it all the way back, and Javi's going to roll his eyes now because I'm a real nerd when it comes to research history and how we've developed and improved what we do over the years. And you can trace the very first research project back hundreds of years to the day of King Nebuchadnezzar. He was doing he was preparing his troops to go to a battle, and he decided that in order to get them as fit and healthy as possible, what he would do is he would feed all of his troops lots of red meat and give them lots of red wine to drink. So do you think that that will make them really fit and healthy if they drink lots of red wine and eat lots of red meat? Is that a healthy diet? Is that going to make them fit? No.
You could probably just argue the reason not many people know about like the researching part of it is because it's not like on the front lines. You know what I mean? Like an immediate response would be like a doctor or like a lawyer or police officer, whereas like you guys are more behind the scenes and obviously arguably just as important. But like you said, growing up, you didn't have this job in mind specifically, but you obviously got to it because like it's not as out there, it's not as like well known. But obviously once you get into it and behind the scenes, if you have the right mentality for it, like if it's something that interests you, then obviously it's something you're going to want to pursue more.
Yeah, I think you're absolutely right. And when the opportunities are there and people are looking for work and they see the word research, I think sometimes that can be a bit off-putting because research sounds like something that somebody else does.
Yeah.
Somebody in a laboratory or somebody sitting in a dusty office with lots of journal articles around them with, you know, crazy hair. But actually research is something that we can all do, and there are so many people in our team and the teams that we work with from a whole host of different backgrounds. I grew up literally down the road from where you go to school, and so, you know, I've got a very different background to Javi's got a very different background to lots of people in our team, but what unites us is that we are all really passionate about developing better treatments, better diagnostic tests for people, keeping people healthier for longer, stopping them from getting ill. That's another really big portfolio of work that we do, is looking at preventing illnesses or diagnosing illnesses such as cancer much more early on, because we know that if we can diagnose people earlier, they have a much better chance of, you know, a better, healthier life afterwards. So there's such a broad range of different work that we do, and I think just going back to what you were saying, I think you're right, we're in the background, and people don't understand that, you know, if you've got a cold and you have your Lemsip capsules to make you feel better, there's that annoying piece of paper in the box that gets in the way when you're trying to put the capsules back. And if you ever stop to read what's on that piece of paper, that's all of the information that we've learned through research about those capsules. All of the information that we learned about that is in that piece of paper, and that's what research does. It teaches us about treatments, what's effective, what dose we need to take, what the side effects might be, and why one might be better over another. So that's all of the work that like Javi and our teams do, go into that annoying little piece of paper, but it's all in the background. You don't hear about that. So I think you're absolutely spot on.
Yeah, I agree with I think there's two bases. There's that bit that, as you say, is a bit of the background. It's not in your face. It's not, oh, I'm a doctor in A&E, I'm a police, I'm a firefighter, you know. But it kind of enables everything else without this research. Like, and this is what I've really realized through when I was working in the hospitals. Like, we were doing things that now we've learned they were doing no good. So as a nurse in the hospital or as any doctor, we were doing what we thought it was best. But until research told us, you know, maybe there's another thing that is better, we could not do that. So I think it is that really enabler. And I think why it's really interesting, linked to what Kelly was saying, if you type research or researcher on, you know, online, you're gonna have like a microscope or something like that, a laboratory. There's some of that, there's a lot of that, but it doesn't need to be. You can have a full-on career on research, whether it's hands-on, like taking bloods, taking blood pressures, helping delivering those studies, or more on the managing the studies that we do. You do not need a university degree. All you need is passion to get there, and there are opportunities.
Would you say there's like quite a stigma, like a stereotype surrounding the work that you do there? Because obviously you keep mentioning, like, you know, when people think like researchers, they think like the laboratories, they think the microscopes, all of that. Would you say there's like a lot of stereotypes that need to be broken down, like over time, in order to make research more prevalent?
Yeah, absolutely. I won't necessarily say stigma, because I don't think there's a negative association with it necessarily, but I do think that there's that stereotype. It's always been thought like that. But research is happening everywhere. Like, you may think of research as that lab, but research is basically us trying to get information to improve things. So the survey that you guys are going to do later, that is research. You know, anything like that is giving us information to improve the services. That is all research.
I think that's purely down to the way we glamorize sort of the like the hands-on side of it. It's all like the way we market it towards children to make them want to do that from a younger age. Like we always be like, be a doctor, save lives, but they don't realise that the research is actually the backbone of it. So like the way we're marketing it towards children and the way we're sort of glamorizing it isn't how we glamorize the research. So like it's sort of, there's also like loads of stuff in media about like, where if you think of a researcher, the first thought of your head is someone hunched over a desk. Whereas think of a doctor, you think someone like maybe like what, doing CPR on someone or like.
Well, you got Grey's Anatomy or
Yeah.
like any of
Yeah.
those programs.
Yeah. So no, they don't talk about the research, and that's probably why younger people don't know about it and why they don't feel they have the opportunity for it.
I was just going to basically add on to sort of like what Javier and Kelly is saying. This is what is very important, the work that we do in the community, is to basically, showcase the importance of the jobs that, researchers like Kelly, Javier, the nursing team, and all this NHS, basically what they do, because it's really important, because what they basically do at the back that people don't get to see is very, very important. And we have to sort of like all come together and then look at what they do, help by feeding back, and also by sort of like even considering to sort of like go and do some work experience, and if that's what you want to do in the future, why not? But it's a very, very important job, and I think it's really, we're very sort of like, fortunate to have you guys here to talk about this, because I think we need to sort of like showcase what you guys do to get it out there so everybody is aware of what you guys do, and then if they want to consider that, because I know Zufi's got a lot of questions to ask.
Yeah, not
just about to.
I was just gonna say, like, the work that you guys do, the people in the front line will, the data that you get, the results that you provide, the people in the front line will apply those results, those data to the wider population. So that's what just.
Yeah, so there's a whole. The NHS has lots and lots of different parts, and the research has lots of different parts to it as well. So the NIHR, the National Institute for Health and Care Research, has a really broad range of functions. So it will fund research, it will give researchers the money to develop and deliver the research, and then we'll help to deliver it. That's what we do in the Clinical Research Network. We go out and about and see those patients, participants, we collect the data and send the data back. And then when it gets to the point where it's all been analysed by the data managers and the data scientists, and a decision is made about whether or not a treatment is effective, then there's a whole other piece of work that goes on with the regulatory authorities about reviewing that data for safety, and then if it's a drug treatment or a medical device, then it will have to have regulatory approval. And once that happens, there's another organisation across the NHS called NICE, the National Institute for Clinical Excellence, and then they'll come together and look at all of the options for treatment and make a recommendation to the NHS about what the best course of treatment is. And when Javier was talking about his career in intensive care, when practice used to change, all of that research would have happened in the background. It would have got the regulatory approvals, and then NICE would have come along. The panel would have come together, looked at all of the evidence, because that's what we want in health and care. We want evidence-based medicine. So you might hear us talking about that. And the reason why it's important to have that evidence is because if you don't have evidence that something is effective and safe, then really we shouldn't be using that and shouldn't be doing it. So NICE will look at the evidence, make a recommendation, and then that practice gets rolled out and changed across the country.
I can give a couple of examples that I've known of. So once, when I was working in the intensive care, helping people, so some people, when they are really sick, they have to be on an induced coma, so we kind of put them to sleep to allow them to recover better, and sometimes we need to use a machine to breathe for them. So when I started my career in nursing, we were using this machine in a way that we thought it was the best. But then a study that actually was done around in Italy, but it was done in a number of places, demonstrated that the way we were doing that, using the machine, it was buying us time, but it was not the best way. So that completely changed, and we learned a new way to use that machine that it was much better. So we were able to help people to recover better, to have less damaged from using all these machines, and that the impact of it is worldwide. Anywhere you go now, if you go to an intensive care unit, they will be using the machine in this new way that we've discovered. Another example, really easy, we go with COVID. There was a really big study that the UK was the lead on, so it was made in the UK. This study discovered the first effective treatment for COVID for the really sick people. So when I was working up in the intensive care unit with all the people that were really poorly with COVID and other infective diseases, that was the first time that we had, as a nurse, as a doctor, we had something that we knew it worked, that we could give to people, and we knew it was getting them better rather than just, oh, let's try that or let's try that. We knew that worked, and that again has saved millions and helped millions of people worldwide to get better.
That's amazing. Aidan, you had your hand up.
No, Kieran, go first.
I just want to ask, like, obviously it's not something that's really like advertised to like young people like wanting to going into a career. But would you say that there's like a shortage of people in research, and if like there was more people, we would be more like medically advanced?
Yeah.
Is that like something that would help?
Yeah, absolutely. We always have opportunities in research, and that's not just locally within our team. That's the good thing about being part of a network is we talk to other people across the country, all across the country, including Scotland, Wales, Northern Ireland, and so we know that everywhere there is a shortage of people applying for roles in research. And I think it comes back to what we were saying earlier. People they see the word research and think, oh, that's what somebody else does, and therefore don't have the confidence to apply for what is a really interesting job, and a really broad range of jobs as well. So yeah, that we always have lots of opportunities, and you don't necessarily need to come with a university degree, but what you do need is like that drive to find out why we do things and want to make things better. That's really key to it.
Is it CRI, the acronym, the heart people? So like for us, like as like young athletes, they found that I think it's 1 in 12 heart attacks in young people are just athletes who are healthier than like the average person. Mm-hmm. But it's that research program that found that, and they're the ones who are doing the testing to check if you're prone to them or not. Whereas you don't see the doctors and stuff testing for that. It's the researchers who test for that, which is much more important because that's something that would actually affects everyone.
Yeah.
Rather than just if you get sick then you go. Whereas that is sort of it's good to go get tested for that.
Yeah, I think what I wanted to add, and I think that is a really good point. We've talked about all of us doing research and the opportunities that they are there, but equally research is a partnership. We could have all this, all the studies, all the team, managers, the nurses, the clinical trial assistant, everything done. If it weren't by people volunteering to do those studies, people coming forward and say, yeah, I'm happy to get tested with this, or I'm happy to have this exam or that. We couldn't get any of this data. So it's really a partnership. Research is not for the researchers, it's not for us. Research is done with everyone and it's for everyone.
I was gonna say, I think Aidan made a really good point about the glamorization of certain careers, because growing up, you think successful careers, you think doctor, lawyer, things like that. And I think within the media, it's quite prominent as well. If you think of a TV show you watch, it's probably got police officer, detective, doctor, and what Kira was saying, if there's a shortage of people, I feel today's a good opportunity to make people more aware in the community. Within these broad institutions, there are certain subsections, little fields where you can thrive. Javier, you were saying you didn't always know you wanted to do this, but you've obviously found a career that suits you. I'm assuming you're doing quite well in it. So it's what would you guys think could be put in place to combat people's general preconceptions about the careers and the things that you do?
I think today is a brilliant example of what needs to be done. It's just about having conversations with people and talking about the opportunities that are out there, and how explaining how research works, and all of the different ways that you can get involved. And you know, even if you decide that a career in research isn't for you, just knowing that when you take that piece of paper out of the LEMS capsules box, having the understanding of the process that has gone on behind that to generate that evidence, it will be really useful, you know, in your lives when you're growing up, if you have families of your own, helping you make decisions about their health and care. So having an understanding of how that all works, regardless of what career you choose, is a really good life skill to have. And I know as a parent now myself, having an understanding of research and how treatments are developed has helped me make some really tricky decisions sometimes.
I think it's not necessarily down to like not knowing, like, not being like intelligent enough for it. I think it's down to just knowledge of it.
Yeah.
Like it's not really pushed forward. It's sort of something you find by maybe wanting to become a doctor and then seeing, oh, this is another pathway, rather than seeing like straight away, I want to be in the research. Whereas I think if all you need to do is learn about it and know about it and just have it sort of spoken to you, and then it's always going to be in the back of your mind as an option. Whereas it's not an option to most people because they don't even know it exists.
Yeah, I feel like you have to go one route and then take like a side road to get to it. I think if you make like an initial pathway, it would be a lot easier.
That's a really good analogy. Yeah.
I think my question to you guys then, obviously, you guys are from different groups that we have, and we have so many other people that are not here today. My question to you guys, you've listened to what Javier and Kelly they're talking to us about today. How can we sort of like utilize this information to let all our other members know what research is about? Or if that means like, do we have to sort of like keep doing this over and over again? Or do we sort of like need to have handouts to take you to these different sessions, different workshops, or bring it to the youth club for people to sort of like see what the research is about? Sorry.
I would say like a lot of the friends like around our age and within the Urban Project, a lot of them are like considering careers in nursing, like doctors or just general science. I think if we spoke to them about it, like just us as like in this room now and spoke to them about it, we could potentially set up a workshop or something. I think doing something within the youth club would also be good because, you know, like we were saying earlier about the stereotypes within the younger minds and their potential career paths, I think the youth club would be a good place to start it. And then if, for example, like you said, within the sports sessions that we do, if just briefly we mentioned something like that, potentially set up a future workshop, posted about it online, social media, I think we would get a lot more people interested.
Okay.
So I think that's something
That's a really question here.
I was going to ask, are there like many obstacles you face in like the day-to-day life being a researcher?
That's a good question. I don't think I've really thought about more than obstacles. Maybe I see them as challenges, so that really drives me forward. I'm a kind of person that I like to find a problem and try and fix it or resolve it.
That's why you're in research.
Yeah, I think and this is just my, where I am at the moment. I think now my work in research in comparison to my previous work in the hospital is a better balance for me at the moment. In hospital I used to do long days, so like 8 till 8, nights, weekends. It's a bit different in research. It's a bit more, Monday to Friday. We cover some weekends, but that doesn't mean that there are no challenges there. So every time, my team is mainly on the delivery. So when a new study is coming out, we need to find out how to deliver it. We always need to prepare. I'll say preparation is like 90% of the work. So we need to think about, okay, they're asking me to test, let's say, this new medication. How are we gonna go out? How are we gonna ensure that everyone that comes forward to be a participant is gonna be safe? How are we gonna ensure that? So there are a lot of challenges. It really makes you think. You need to think a lot about problem solving. But then what I like is that you got that heavy aspect of problem solving, of using your brain, like, oh, I have a challenge here, how do I come around it? But there are some regulations that you need to adhere to. So it's just thinking about all that. But what I like about it is that it still has that hands-on that I like. So in my weekly basis, I will come and talk to people that want to take part in research. We'll take the samples as required, so blood samples. We'll take their blood pressure, pulse. You still get to do that side of like more medical things, if you want to say that.
Yeah.
But got a lot more of that challenge and problem solving.
We have another question around the table. So.
Kingsley.
Yes, I want to ask a question actually, sorry. So at the moment, let's just say we have people interested, how many of these young children can you take at a time? That's number one.
So the work experience?
Yes.
Yeah, so we can take 2 at any one time.
Right.
So the scheme that we've set up is a 3-day scheme.
Right.
And we thought it might be nice for you to have a buddy, which is why we've gone with 2, so that
Brilliant.
you can go through it together.
Okay, and so that'll be for 3 days?
Yes.
Okay, and also what's the minimum age?
So we are employed by University Hospital Southampton, who we know really well because it's just down the road from where we are. So they have a policy that it has to be 16 plus.
Right, okay, that's what I want to know.
So the way to think about it is, if you're not at that age now, doesn't mean that you won't get that opportunity going forward. So you mentioned that what can we do to actually make sure that people know about all these other careers that are not glamorized. Phase 2 of the youth development program is geared towards that specifically. So that's why we've had the pleasure of Kelly and Javi. So a bit of background to how we met them. It was through a community champions project that we were doing with the NIHR, which was trying to make sure that people from underrepresented backgrounds actually understood and had enough information to see if they wanted to take part in research. So by underserved, it's not just along ethnicity lines, but the youth as well, because there's a lot of studies that require younger people to get involved. And if you guys don't know about research, or that your participation is quite critical to all the deliverables that these guys deliver, then that's where the issue is. So we asked them to then take part in this. I think the first time you probably saw them was through the podcast where we were talking about our experience during that project, which then set up today. So there's going to be a lot more of this sort of setup where we invite professionals to talk about their own careers, so that you guys can understand that it's not just the box standard, be a lawyer, be a doctor, be an accountant, that are out there. Because I trained as a town planner, but the expectation was that I was going to be a doctor because my mum was a nurse, a lot of my brothers are nurses, so they expected me to do that as a minimum. But people are different. You remember I was talking about the psychometric tests. So if you answer the questions on that questionnaire, it will tell you what sort of careers you're more likely to thrive in because of the way you approach things or the way you react to things. So doing those sort of things opens up your imagination in terms of like, right, what career path could I explore? Sorry, yeah, for the question.
Do you also think another reason why these behind the scene jobs aren't as advertised is because of money? Because obviously a lot of parents, they're like, oh, you should become a doctor, you should become a lawyer, you'll be able to make good money for your family, all of these things. Do you think that's another reason why people don't know about these behind the background jobs, because there's like an idea that, oh, you won't earn as much because you don't specialize in something like a surgeon, if that makes sense?
Yeah, well, it depends what sort of family background you come from. So I work in a particular job where probably I'm on par with the GP, but it's a niche job. You wouldn't know about it. But because I explored it and I was fortunate enough to be exposed to it and to people that work within it, I managed to work my way into it. And because of the value that I deliver for the company, I'm paid to reflect that. So the way to think about it is, you might go into these particular jobs. I suppose it's more stringent within statutory providers or local authorities where they've got banding in terms of what you can earn. But there's transferable skills, and just because you trained or you came into a role at a particular level doesn't mean you always stay at that. So be always looking to improve your skills and generate additional value, because if your employer sees that you are putting that value in, then they will reward you, and those opportunities will open up for you. Because I don't know if Kelly wants to talk about her history going into her career and what was expected of her and where she is now, because we had that conversation and I was welling up when she was talking about it, because it's sad sometimes that society's got a certain expectation for you, like, well, that job is not for you. But I'll let you talk about it, because it's such an amazing story. If you want to share.
Yeah, sure. So I grew up in Millbrook in Southampton, and it was a long time ago now. It's 20 plus years ago. Because I said I'm old. And the kind of expectation for me back at that time was that I wouldn't have a career. I would probably just, I'd go and start my family at a very young age, like lots of my friends did, had families before we'd left school, if I'm honest, and I can see you nodding along.
No, that's a thing.
Yeah. That, the bar was set very, very low for me at your age, and for a while I thought that was my limit, that was what I could expect to achieve in life, and there's absolutely nothing wrong with that. I'm not saying that that's not a good life for people, because I know, lots of my friends that I'm still in touch with that started their families when they were still at school. They have a good life, they're happy with it, but it took me a while to understand that just because other people had an expectation about what my life would be like, that wasn't what my life actually needed to be like. I could decide how I wanted my life to be. And for a long time, I really, like I said at the start of this, I didn't know what I wanted to do. But I was lucky that I had family support in place to give me the time and the space and the support to say, you do what you want to do and we'll support you. And so I started off in a really junior job in the NHS. So you were talking about bandings. I came in as a band 3 within the NHS. And in every job that I've described to you today, I learned something different, and sometimes I learned things the hard way. And I'll be honest with you, the reason I'm such a stickler for the rules and the regulations is because I made a few big mistakes along the way that I learned from, and then I realised actually, I dropped the ball there, wasn't so great. But rather than kind of take that to heart and run off and not carry on developing, I realised that I would learn from that, and that experience helped me to develop more transferable skills, more experience, gave me a bit more confidence in a weird way. I've had that setback, I've had that knock, but I'm stronger for it, so therefore I'm going to carry on. And it has taken 20 years, but I couldn't be more happy with the job that I've got. I love what I do, and I love the team that we have with us and helping to support them to do all the amazing work that they do. But the expectation was never that I would do that. The expectations for me were very, very different, and that's why I'm so passionate about the work that Air Bonds do, because you can do whatever you want to do. It's nobody else's decision. You decide what you want to do. You set your own limits. You set your own bars. If there's something out there, you want to reach for the stars, you reach for the stars. Nobody is going to hold you back apart from you. So, and I kind of learned that the hard way at times.
Yeah.
So,
and I think, if I may link into what you guys both have said, and bringing it back to, what the NIHR offers, like, if you think that you can join as a clinical trials assistant, possibly around a band 3 or band 4, you don't need any university qualification, you just need to want to, do a career in research, really understand to the things. That is part of that, developing those transferable skills. So we have a lot of, within our team, we have people that started at that level, same as Kelly, and now they are around where Kelly is, or assistant portfolio managers, and they are possibly those earn more than a nurse in the hospital if you're looking about money, and that's a very different pathway to. If you think about your surgeon, you need to go through med school, specialized, be really competitive. There's a lot of study, and effort put there. Some people are not good to study, but that doesn't mean that they cannot do good and have a good career for them. So I think that's important too.
Yeah. So if I give you a bit of a background to how I entered my career, just to give you an example of how like you can get in sideways and get onto the track that you need. So I graduated from about 2010, and someone around the table here will know that that was at the height of the recession, and I just finished an architecture degree, and no one was building. So you can imagine there were no jobs. I knew I wanted to get into town planning, but because of the recession, there weren't any external roles that were being advertised in any local council. So I thought to myself, right, I just need to get my foot in the door. Guess what I started off doing? I was a ride-on mower driver. You know those people that you see cutting the grass? Yeah. So my tactic was get in there. Those internal opportunities will open up. I've got a degree. When those internal opportunities come up, I've got customer service from when I was working at Asda during uni. I've got my degree. If anything comes up in the planning department, I've got a good shout. And do you know who was telling me about all these opportunities? My supervisor within my grass cutting job, because he saw the work ethic within me. It wasn't about, well, that job is too good for you, but I got in there in front of someone who could see my potential and the hard work that I was putting in. And there's nothing stopping any of you being able to do that. If you think like, right, how do I break down that door to get into that?
Can I
Just
add to that?
strategize. Yeah.
Because what you said, it looked at me actually when you said someone in this room.
Yeah.
It's ironic that you should actually look at me and say, by trade, I'm a financial advisor. And this is not, just to show a little bit of background, how difficult it is to gain. I finished, I had a degree, I've got a degree of business and finance. And I said, what do I do? And when I finished, nothing available to me. And this goes to all of you, really listen to this carefully, especially those in the minority. Is really important because I've never told anybody this story. Nobody even knows my story, not even Drami, of where I am today with what I do, frankly.
Do I need to work this down?
No. It's just really, if anything, it's for them to realize that you can do whatever you want if you put your mind to it. There will be distractions, there will be big hurdles, but if you're determined to get there, there's nothing stopping you. Yeah, I face hostilities quite a bit because of the industry that I'm in, literally. I started back in 2000 and, could be away now, but I finished university in 1996, and I started with Pearl Assurance, and you will know about it, and just doing normal. I was just like started from the bottom, literally. They advertised, and I wanted to start something, get my foot through the door, have my objective, what I want to achieve, set my time, a goal. 2 years, 3 years, where do I want to be in that position? So I went in there with my qualification. It's really not a great job. I have to go and collect people money. It's just like those days you do savings, but the salespeople come to your door and actually collect the money, put them in a bank and all of that. You do that. So that's how I started. Through that, you get to sell buildings insurance and contents insurance, car insurance, and you have a manager who manages you. So I try so hard, my goal was 3 years from then, I want to be an area manager. But then you need to do a professional qualification, get your FPC, financial planning certificate, 1, 2, and 3. When you get that, then you go to the next stage. And it's amazing how when you set a goal, believe it or not, guys, you achieve it. And I can tell you, I set 2 goals in my life, and I was amazed how I achieved that, including when I want to get married and have my first child. I envisaged this in my head, in my night plan it, and I cannot believe that both worked almost the year that I wanted to happen. So going to this financial advisor stuff, you go and pick up, you go and see people. If you have a proper lead, someone wants to do insurance or life insurance, whatever, I pass it to the manager. cut a long story short, I was so good, so successful, I was top 3 in the branch consistently. So of course they noticed that, so they put me forward to go for FPC 1, Financial Planning Certificate 1. Fortunately, I got it. And then 2, and then the 3rd one. So within 3 years, my plan, almost to the month, I was promoted to become a financial advisor then. And it was amazing. And the hurdles that I faced was, unfortunately, those days, back in the late 90s and early 2000s, unfortunately, there were hurdles that my face didn't belong to that particular industry.
Yeah.
And I had issues with my managers after manager. The only thing that kept me there was I talk the talk and walk the walk. What do I mean by that? You know, I had a manager, I told him that he deemed that I wasn't good enough. I told him that I will prove you wrong. I actually told him that because if my back is against the wall, believe me, I'm a different animal. I have to prove how I am. Unfortunately, you know, if you have to push me to that limit to get that out of me. So, but I did prove him wrong. So, how did I start? Like I said to you, I got there. And then eventually I became a financial advisor. And within the new promoters, they do special sales incentives. The new promoters throughout the country, this is a national company. Again, all the best people within the regions were invited by the head to dinner, and you were giving, I can't remember, 300, 500 pounds for being top of your sub-region, basically. You know, so this is just trying to tell you guys that today, the lifestyle is completely different. You've got a lot easier, believe me, a lot easier. So, if anybody says you can't do it or putting down any hurdles on you, please disregard it. Like everyone is saying, psychometric text, God knows how many times I had to do all of that within every application I filled in. You know, it's just seeing where you are. If I were you guys, me personally, I would try and go on this work experience just to see what it's about. Even if you don't, you'll be surprised, you know. And if it's another one, I'll go to different ones to see which really matches mine. So what Airborne is doing is really, again, you are lucky. If I had this when I was younger, you know, it would be great. So please take advantage of it, all of you guys. And more importantly, talk to your friends. So what we are trying to do is to give you the lifestyle that we never had. Okay, so there's a lot I could say, but I'll just leave it at that.
No,
I don't want to.
I think you said it all, Kingsley. We're here to sort of like make this easier for you because, again, as he said, we never had anybody to sort of like put anything on the plate for us. So this is an opportunity. I'd love to see you guys come into the sessions because it keeps you mentally and physically healthy. Great. I'd love to see you guys making friends with other young people from the community. It's brilliant. But what I'd love more to see is to see you guys like 10, 15 years down the line. You have great careers, you know, you're doing very well. And you can then sort of like reach out to help more people. Yeah. Because if you don't have any, how can you help anyone? So I'm very passionate about helping you guys, and the team is very passionate helping you guys. And this is why Saturday morning we've got Kelly and Javier here today talking to us about careers. You know, I know the jobs that you guys sort of like think the first are the jobs that you see on TV, are the jobs that people talk to you on a daily basis about. But these guys, I mean, they do a lot at the back, and you know, I'm not going to be able to sort of like tell you how much they earn and all these sort of things, but I know those jobs require a lot of money to be paid to people in order for them to do it. So the work experience that's coming up, you know, seize the opportunity to apply for it. If you do get the chance to go, great. But it's not one-off. You know, I'm sure, Kelly, there'll be a lot.
We're really excited about the work experience. It's generated a lot of interest and excitement in our team.
Exactly. It's not one-off. We're talking to sort of like the NHS as well to sort of like create more work experience there. We already have got work experiences at the moment in the community with Richmond Motor Group. They're taking like marketing, HR, IT. We've got a lot of young people that goes to those kind of things. Yeah, those workshops at the work experience at the moment. So I think it's in 2 weeks' time. We've got like 7 people lined up again to go back to Richmond And we've got like other companies now sort of like taking more young people. The council is like looking to take more young people to sort of like do work experiences. It's good for your CV. It's good for your university applications. You know, when you're applying to go to uni, all these things that you're basically doing is great for your CVs. It's great. People that are actually sort of like, you know, taking you, they would love to see what you've done previously, so they can actually sort of like, you know, give you more opportunity to come on board. So we're going to be doing a lot of this, and seize the opportunity to sort of like better yourselves. That's all I can ask. Come and talk to us, and then we'll sort of like find what you're interested in. So far, we've never been able to sort of like say to someone, "Here we come," and that's the great thing, because we've got so many different people around us. You know, you've got like Joe in totally different industry, you've got Kingsley in different industry, and then we've got so many other people in different industries, and then we're bringing all that into the community to make our community better. So what I want you guys to do, bring us the problems, and we're going to sort of like talk to the professionals, our partners, and see how we can help you to become the person you deserve.